Okay, so now we are moving to the cancers of the lymphatic system. So I'm going to do this as a combination. So we're going to talk about Hodgkin's disease and non-Hodgkin's in this same lecture. So Hodgkin's disease is a cancer of the lymph system, but the big distinguishing characteristic you're going to see with Hodgkin's is the presence of something called Reed-Sternberg cells, and that's actually how you determine whether it's Hodgkin's versus non-Hodgkin's lymphoma. If there's Reed-Sternberg cells, then it's a Hodgkin's disease. So um, the exact cause of Hodgkin's disease is unknown, although there is some indirect evidence that suggests it may involve a virus. This disease is most common in your younger adults. You'll see Hodgkin's disease like in your pediatric patients, specifically like your adolescents. So it's not uncommon to see it there. What you're going to see with Hodgkin's disease is you're going to see an enlargement of the lymph nodes, the spleen, and other lymphoid tissues that are going to result in a proliferation of lymphocytes, eosinophils, and again, those Reed-Sternberg cells, okay? Because that's going to be the hallmark of the disease is that Reed-Sternberg cells. So usually the first sign is going to be a painless swelling of the cervical lymph node or occasionally a lymph node in another area. Other symptoms that will include like pruritus or itching, persistent fever, night sweats, fatigue, weight loss, overall malaise. Late stage signs and symptoms will include facial and neck edema, jaundice, nerve pain. You'll see enlarged retroperitoneal lymph nodes. And then you'll start seeing infiltration of the spleen, the liver, and the bones. The other thing that's important to know about Hodgkin's disease, because this is another distinguishing characteristic, is that Hodgkin's disease has pain that's induced by alcohol. So alcohol actually exacerbates their symptoms. And then I've already talked about the late signs and symptoms here. So what we're going to look at is you're going to need to do a lymph node biopsy because that's going to reveal the abnormal proliferation, and then it's going to show you those Reed-Sternberg cells. The lymph node biopsy is also going to be used to determine the lymph node and organ involvement. We'll do blood tests to show anemia. You will look at the WBC count, the differential. You can look at staging. Okay, staging will be done through the scans a lot of times. CT scan can evaluate the extent of the disease. We can do lung scans, bone scans, lymphangiography. That's where they inject the dye into the lymph nodes. But again, the way that we definitively diagnose this is through the biopsy, okay? So a lot of times they're going to biopsy the lymph nodes, they'll biopsy the bone marrow, and then as it starts invading the liver and the spleen, they may do biopsies there as well. So this is actually how it's staged. When we're looking at staging systems, it has to do with stages 1 through 4. If we're dealing with stage 1, we're dealing with single lymph node involvement. Stage 2 means 2 or more nodes on the same side of the diaphragm. So that could be 2 axillary lymph nodes or a cervical and an axillary lymph node. Stage 3 means that we have nodes on both sides of the diaphragm. So you may have cervical node involvement and inguinal, so that would be like in the groin. Okay, so both sides of the diaphragm would be affected if you have stage 3 involvement. And stage 4 means it's basically everywhere, widely disseminated disease in the organs and or tissues. So interventions, so most of the time what you're going to see, anytime you have a blood or a lymphatic cancer, chemotherapy is going to be your primary agent. Okay, chemotherapy is better for your diseases that way. Radiation is helpful, especially if you have tumors that have metastasized as well. Radiation would shrink down those tumors, and it also sometimes helps with some of the pain that they're experiencing. Nursing diagnoses for your Hodgkin's disease, impaired comfort's a big one, activity intolerance, risk for infection, risk for ineffective coping. The nice thing about Hodgkin's disease is that it's potentially curable even in the advanced stages, and appropriate treatment yields long-term survival in about 85% of patients. So Hodgkin's disease of the two is the most curable. So again, it's still a cancer diagnosis though, and so we need to make sure that we monitor our patients closely for any toxicity caused by chemotherapy or radiation. You want to provide that emotional support and appropriate counseling and reassurance, and make sure that we not only are including the patients but their family in this process as well. All right, non-Hodgkin's lymphoma. So this is a lymphoma that arises from the B cells and the T cells. So those are the lymphocytes, okay? This one, contrasting to the Hodgkin's lymphoma, there is no Reed-Sternberg cells in your non-Hodgkin's lymphoma. Now, what they've linked to this one to is some viruses. H. pylori, you'll hear that when you guys get to GI in 206. Immune dysfunction, occupational exposures, so a lot of the things that cause our other cancers, non-Hodgkin's lymphoma also. So signs and symptoms, you're going to have the same signs and symptoms as Hodgkin's disease. Both lymphomas are going to present the same way. Painless lymph nodes, enlarged tonsils if they still have them, and all the other, non-specific symptoms that we discussed with your Hodgkin's disease. So we're going to do this exactly the same way. We're going to biopsy the lymph nodes. If we're dealing with the tonsils, we may have to biopsy them. We're going to do the bone marrow, the liver, possibly the spleen, okay? But remember, we have to biopsy the lymph nodes to get our diagnosis here. Non-Hodgkin's tends to metastasize pretty quickly, so you may want to do a bone scan, CT scan, chest x-ray, MRI. PET scan will show you how much involvement we're dealing with. CBC, we want to look at our white blood cell count, our red blood cells, our platelet numbers. We want to look at our liver function studies to see if our liver is still functioning. We want to look at our serum calcium levels. So we're going to see, how much metastasis we've got, and we're going to start doing scans to determine the extent of this disease. Now, non-Hodgkin's lymphoma is more deadly than your Hodgkin's lymphoma, so we are pretty aggressive with treatment here. So in addition to chemotherapy and radiation, your patient may get monoclonal antibodies or interferon therapy. That is going to be designed to help the body boost an immune response, okay? And the big thing that we're seeing for your non-Hodgkin's lymphomas are stem cell transplants, okay? Currently, that is the recommendation that they are giving patients for non-Hodgkin's lymphoma. So once your patient goes through chemo, radiation, and gets into remission, then they will look at a stem cell transplant, because with non-Hodgkin's lymphoma, it's not about if the cancer come back. A lot of times it's about when it comes back. And so to prevent it from coming back later, they're going to look at doing a stem cell transplant. All right, nursing diagnoses for your non-Hodgkin's lymphomas, activity intolerance, risk for infection, risk for ineffective coping, all the same nursing diagnoses that you would give any patient with cancer. So this is a comparison of the two lymphomas. So like I said, the symptoms are relatively going to be the same, but there are a few distinct differences. Hodgkin's is going to be less common, whereas non-Hodgkin's is more common. Hodgkin's we typically think of as your young adults. And then again, the incidence increases after the age of 55. Non-Hodgkin's almost always over the age of 50, okay? Hodgkin's has the Reed-Sternberg cells, where non-Hodgkin's does not have them. You have a better prognosis with Hodgkin's. You have poorer prognosis with non-Hodgkin's. And then Hodgkin's has that alcohol-induced pain that also comes with it. So spend some time comparing the two lymphomas. Make sure you guys understand the difference between the two. But like I said, the big thing I'm gonna tell you here is those Reed-Sternberg cells. Those are almost always the testing question that I see in comparison with the lymphomas. All right, and that's gonna wrap up the lymphoma lecture.